All right, Stephanie, thank you so much. On today's New Notebook, we're talking about the major debate going on across the country over the best way to treat pain. I have Dr. Coury, who's joining me from Desert Sky Spine and Sports Medicine. Thank you so much for coming in, doctor.
Thank you for having me.
Yeah, so speaking about that debate on handling pain, this is in light of the new legislation that is targeting the opioid epidemic. Now, how is your practice handling treating patients' pain in this type of climate?
Yeah, it's a great question. It is a big debate and things that are going on right now. First of all, we want to say that it's really important that pain not be the final measure of how opioids are doing. That was kind of the goal in the past, was what level of opioids people need in order to be out of pain. And we really want to focus more on function. What's the functional outcome for someone to be out of pain? The CDC guidelines and the Arizona state law are very clear that we're really concerned about escalating doses of opioids with no outcome other than pain. So we really want to get back to functional outcomes. And part of those restrictions and laws include a reassessment of someone's pain. And so we want to be able to look at, are the medications working, as well as what are some other non-narcotic things we can do to try to help with that. That said, though, we don't shy away from medicines if they're important and if they help people. And so that's the back and forth balance that we have to have with patients.
Okay, and what about the people who have been on a pain regimen for a while and they know the dangers that lie with addiction? What do you say to those people as far as how they should battle their pain relief?
We see that a lot. We see a lot of people that feel they're stuck, where before it was how much medicine do you need in order to be out of pain? And now they're being told they need to start coming down or reduce or even eliminate their medication. And we get that. What I would say to that is that there may be an opportunity for that discussion, that dialogue, where if someone's on high doses of medications and they're also on still have a lot of pain and are still not really functional, then the question becomes, are those medications even helpful? And sometimes we see in our practice, just by coming down a little bit and having that conversation, we can actually make people better and have better pain and function outcomes.
All right, Dr. Coury, thank you so much for coming in. We really appreciate the great information.
Thank you for having me.
We'll be right back after this.